So now we'll be discussing on phenytoin. Now we must know phenytoin is an anti-epileptic drug. It is one of the very commonly used anti-epileptic drugs, especially in India. It is very commonly available and it is pretty cheap compared to other newer anti-epileptic drugs. Now it is a barbiturate analog and it has a very mild sedation property. So most of the time, most of the patients don't feel sedation or sleepiness. The most prominent action of this phenytoin is abolition of this tonic phase of GTCS because we have tonic and clonic phase, so it has excellent effect on tonic phase especially, and it has no effect on the clonic phase. That is how it also limits the spread of seizure activity. The mechanism of action is it prevents a repetitive detonation of normal brain cells or neurons. It prolongs the inactivated state of voltage-sensitive sodium channels. Sodium channel is the main reason why the patients get convulsions. So it keeps the inactivated state more prolonged and it inhibits the generation of seizure. So the high frequency discharges are inhibited and it has very little effect on normal low frequency discharges. It also depresses presynaptic release of glutamate. Glutamate is an excitatory a neurotransmitter, whereas it facilitates the GABA release because GABA is inhibitor transmitter. So this is how it not only inhibits, it not only acts in or acts over sodium channels, it also acts over calcium channels also. It reduces calcium influx, it reduces glutamate, and it increases or it facilitates the GABA release. That is how it selectively suppresses high frequency firing, hence, it is also effective in trigeminal neuralgia and in cardiac arrhythmias as well. The half-life of this drug is around 12 to 24 hours, and as the drug keep on accumulated in the blood, as the plasma concentration rise, the half-life may be increased up to 60 hours. One of the most common problem why phenytoin is nowadays uh, not that much preferred is because of its side effects, that too on prolonged use. So very commonly gum hypertrophy because of overgrowth of gingival collagen fibers and associated with poor oral hygiene, hirsutism, that is presence of coarse facial hairs or beard, or male type facial hairs in females, hypersensitivity like rash, discoid lupus erythematosus, or lymphadenopathy. These are the common problems that can be encountered. Very commonly, it causes deficiency of vitamin B12 and deficiency of vitamin D. So, megaloblastic anemia can be very commonly found in patients who are taking eptoin or phenytoin for a longer period. So, osteopenia is also common. So, all these patients who are on phenytoin must always get vitamin B12, vitamin D, calcium supplements to tackle the problem of osteopenia and B12 deficiency. This drug is definitely not used in pregnancy or it is not started in the pregnancy because it can cause cleft palate, microcephaly, and hypoplastic phalanges as well as some other growth anomalies as well. Whenever there is overdose toxicity of this phenytoin, it's very commonly produce the cerebellar or vestibular side effects. These are one of the most important problems why many of the patients who are on phenytoin, we need to stop or reduce this drug as fast as possible. So symptoms are ataxia, vertigo, diplopia, and nystagmus. This can occur even at a lower dose. So in those patients, we may need to reduce the dosage of this phenytoin. Drowsiness, behavioral changes, confusion, hallucinations are also reported. Disorientation and rigidity, these side effects are also reported with phenytoin. Whenever it is given by injection, it can, if it is given by rapid IV injection, it can cause local vascular injury, edema, discoloration, and tissue necrosis, and it can cause fall in BP. That is the reason why it should always be given with ECG monitoring, preferably in ICU setting, because they can uh, the patient may have arrhythmia. Very commonly, it interacts with other anti-epileptic drugs like with valproate. It also interacts with isoniazid and warfarin, as these drugs they increase the levels of unbound phenytoin. So patients may suffer or patient may have toxicity even at therapeutic dosage given if the particular patient is on valproate or isoniazid or the warfarin. And this carbamazepine, phenytoin, they induce each other's metabolism, so they reduce the efficacy of each and each other's drug. And this phenytoin commonly inhibits the metabolism of warfarin. Uses One of the most common use is generalized tonic-clonic seizure in maximally the government setups or private setup. It is very commonly widely available, and for all those patients who are presenting with status epilepticus, generalized tonic-clonic seizures, or partial seizures, this drug is definitely used. It can exacerbate myoclonus or absence seizure, hence we have to be cautious. The loading dose whenever a patient is presenting with status epilepticus is 20 milligram per kilogram. So if the patient has weight of 70 kg, then we give around 1.4 gram in 100 ml and we give that over a period of 30 to 45 minutes. It should not be given with a glucose uh, drip because if it is given with glucose, this drug gets precipitated in that drip or in that uh, bottle. Uh, Once the loading dose is given, the injection eptoin is continued at around 100 milligram every 8 hourly, so 3 times a day. And once the patient's conversion is very well settled after a period of 3 to 4 days, then this injectable form can be converted to oral form, and it is usually given 100 milligram 3 times a day. And then patient is discharged on the same dosage. And over a period of time, if it is unprovoked seizure, the anti-epileptic drugs has to be continued. Or if the seizures are provoked, then the eptoin or phenytoin can be tapered over a period of few months to over a period of years, so that the dosage can be minimized to as much as possible. So thank you.